A common area of medical malpractice that Louboutin and Unitin works on is delays in diagnosing and treating various types of cancers. So the reasons and circumstances leading up to a delay or misdiagnosis of cancer falls into two types of categories. The first category is the doctor or healthcare provider's failure to order the tests necessary to determine if the person has cancer to begin with. There are certain cancers out there that have telltale signs and symptoms that if the doctor or the hospital becomes aware of, indicates that certain testing, whether it's a biopsy, whether it's certain types of radiology studies like a CT or an MRI, must be performed. And if the doctor doesn't order those tests and the patient goes on to develop that type of cancer and it's very far down the line and cannot be treated as well as it would have been if it had been diagnosed earlier, then the doctor can be held responsible for medical malpractice for failing to order the tests that would have revealed that cancer at an earlier stage. The other category of medical malpractice cases that arise in the setting of delayed and misdiagnosed cancer are situations where the tests were performed, but they were either misinterpreted or not acted upon. So the misinterpretation cases you can think of in pathology or radiology. So many times a doctor will order a biopsy, for example, and they take some tissue and they send it to a pathologist, which is a specially trained doctor who looks at tissue from the body under a microscope and can help determine what that tissue is. Is it cancer or is it benign, not cancer? If a pathologist gets a slide and reads it as not cancerous, but it is cancerous and it leads to a delay in treatment, that could be medical malpractice. The other common setting is radiology, where a radiologist receives an MRI or a CT scan and, for example, maybe there's a lung nodule on the person's lung and the doctor either interprets it as something not worrisome or fails to interpret it at all, and it turns out it was cancer, and again the patient goes a significant period of time without proper treatment. That could be malpractice on the part of the radiologist. Now, the final piece of it in that setting of where the tests that were necessary to diagnose the cancer were actually performed that can lead to malpractice with respect to misdiagnosis and delayed diagnosis of cancer is if the pathologist or radiologist makes the correct interpretation, but then either fails to communicate the information to the patient or ordering doctor, or the ordering doctor fails to respond to it when they get the information. This is where you can see system failure type cases. For example, the radiologist or pathologist doesn't pick up the phone or send an email to the doctor indicating, hey, your patient has a serious malignancy. We just want you to be aware of that. Or the results of the MRI or the CT scan or the pathology get to the doctor's office, but for one reason or another, it's not properly communicated to the patient. Sometimes it can be as simple as a representative of the doctor's office, a medical assistant, a secretary, fails to communicate the information to the patient or doesn't tell the patient properly what the medical diagnosis means, and the patient in turn doesn't get the timely treatment that they need. So those are the big picture scenarios in which misdiagnosis and delayed diagnosis of cancer cases can occur.